With the health care fight heating up in the Senate, local citizens of Dallas held a rally in front of Senator Cornyn's office at 12 p.m. on July 9th to deliver petitions asking the senator to support President Obama's health care plan, including a strong public health insurance option. President Obama has been steadfast in his support for a public health insurance option, which will give Americans a better range of choices, make the health care market more competitive, and keep insurance companies honest. Last week, the Senate Help Committee joined several committees in the House of Representatives and released a bill including a public health insurance option.
Public health care option is an absolute necessity. I've been in the healthcare industry from various sides.
What do you do in healthcare? What did you use?
I'm a computer consultant, and I worked for hospitals and also insurance companies, and I consulted with the hospital for like 9 years. But basically, what I witnessed, especially, and this goes back to times when HMOs and PPOs were just getting started, and the realization was that they were clearly saving money by restricting the services that was provided, and now they're talking about, and they still do, and there's talking about the government, anything that government does as a means of controlling,
So you're saying that they make their profit by denying health care?
Absolutely, absolutely. And not only that, they've got a tremendous overhead in shuffling paper back and forth, that if they can cut out hey, this goes to another insurance company who fights back and forth about who's responsible for paying for it and stuff like this.
At the rally, residents who were struggling with their own health care stories demonstrated why a robust public health insurance plan is critical to solve the health care crisis in Texas.
Part of the problem is that, Medicare has like 3% overhead between the money that comes in and the money that's paid out in claims. I think it's actually less than 3%. And the health insurance industry overall, the overhead is more like 37 or 42% or something like that. It's just part of the reason that the coverage is so expensive is because they have such high overhead.
At the end of the rally, the group delivered petitions from MoveOn members statewide asking Senator Cornyn to support a strong public health insurance option.
I'm out here today to help the rest of these folks get the message across to Senator John Cornyn and some of our legislators in the state of Texas that this country is in need of some serious health care reform. And it's with their backing that we can get this done. So I'm here with the rest of these folks today to get that message out that we're counting on them to really, truly work in the effort of bipartisanship to get something accomplished finally for the American people. So many have slipped through the cracks over the years, and it's getting worse. I don't know what's going to be there when I retire in 8 years, and I don't know what's going to be left for our children. The time is now, so that's what we're out here today to do. Ask for their support as a senator and legislator from the state of Texas.
When you mentioned you didn't know what's going to be there for you when you retire, were you referring to Medicare?
I'm referring to Medicare, I'm referring to retiree health care that these companies so quickly shed when they go to bankruptcy court. There's a myriad of things that are affecting the working men and women that have retired, and they see their benefits cut, whether it's Medicare, Medicaid, the pharmaceutical drugs that are covered by the insurance companies. It seems like the insurance companies and the pharmaceutical companies have more of a say-so in the person's health care than the person and the doctor that's treating them do. And that's got to change. It's fundamentally wrong. There's a lot of people that aren't getting the care and treatment that they so desperately need.
Well, it started to change in 1971. I mean, prior to 1971, the idea of the profit incentive being what it is didn't exist. It was, you're aware that it changed fundamentally back then, and that's why it's morphed into what it is now.
That doesn't mean that that's correct.
Oh, I understand. I'm just giving you a historical backing.
I understand what you're saying there, and sadly to say,
it's been a long time.
It has been a long time, and change is so desperately needed, and the time and the mood in this country, I believe, for that kind of change is now.
Let me ask you something. If you were to compare the quality of health care that people were getting prior to 1971 Not counting the fact that we've made advances, but the just general overall quality and affordability prior to 1971 and today, what would you say the comparison would be in your own words?
Well, I think it's definitely gotten worse. I think there's so many people now that can't afford it. When you look at the jobs and the amount of where wages have stagnated and digressed to the point where people have to work 2 and 3 jobs just to feed their family, not to mention make a mortgage payment and buy gasoline or pay for their energy. We saw what deregulation in the electric markets did. You know, where's the deregulation for the medical industry at? And what's that going to cause later on down the road?